as part of my job, I have the privilege of speaking to healthcare providers and medical students and medical residents on the subject of harm reduction. And this is a subject that is kind of near and dear to my heart, not only because as an addiction case manager, I've seen it work countless times, not only because there's great evidence to support it, but because I'm, kind of a living, breathing example of harm reduction working. Because before working in healthcare, I was a consumer of healthcare as somebody who used substances for a number of years and struggled with them, and harm reduction was my pathway out. So maybe I'm a little bit biased. Harm reduction isn't for everybody, but for the people it works for, it works wonderfully for. And let me kind of go through first the kind of 6 principles. There's probably more, but the 6 principles of harm reduction. So the first one is humanism. That one probably doesn't need too much of an introduction, but people deserve to be treated with dignity and respect, regardless of the health choices that they make, and that should be pretty intuitive to everyone. Pragmatism. So this is a good one, and I think this is one where I usually ask people to reflect on their own behaviors and decisions that they make. None of us make perfect health decisions for ourselves. If you reflect upon your own decisions, maybe it's sugar, maybe it's you smoked, maybe it's you drink above the recommended amounts on the weekends occasionally. But we all make decisions that can be not the best for us, and we know that. And so individuals that use substances are no different. Sometimes they are impacted by social and cultural norms in their communities, and there's a lot of reasons why they do what they do. But we need to support them anyway. Individualism. So each of us has their own needs and strengths, and all of us do. And so we can't treat people as they're one homogenous group. We require a spectrum of intervention options to support people, and that's key, and that's key to healthcare everywhere, really. Autonomy. Well, as providers, we can provide education, we can provide information, we can provide our recommendations, but at the end of the day, individuals that use substances are entitled to make their own choices with terms of which medications they want to take, which treatment they want to do, if any, and what health behaviors they choose to make. It's their decision to make. It's their life to live. Incrementalism. So incrementalism, this is a kind of the basis that kind of any positive change is a good change. And, and we need to celebrate every positive change that there is for folks. And sometimes these positive changes can take years to develop. It's not an overnight thing by any means. And sometimes it's not uncommon that people will regress and retrace some of those earlier advances. That's not it's not an unheard of scenario. Accountability without termination. So patients are responsible for their choices and their health behaviors, and patients should never be threatened with negative consequences or face negative consequences for behavior choices they make. And I think that's key, and if you take it across other areas of medicine, if you think about somebody who's diabetic, as an example, I mean, would we stop giving care to a diabetic because they ate pecan pie over the weekend and face the consequences for doing that? No, we wouldn't do that. So it's this is a unique field where we often, unfortunately, historically have penalized individuals for decisions that they make. And it's not really replicatable in other fields of medicine that I can think of. So I think that's an important one. Now, in practical terms, what is harm reduction, right? So practically, harm reduction can mean needle kits. It can be setting up a clothing bank in your facility. It could be setting up drop-in hours for your patients. Now, why do I say drop-in hours? Well, because a lot of our folks that use substances have really hard time with appointments and often don't make appointments. And if they do make them, they could be quite late. And so sometimes drop-in hours are something that we can do to accommodate them, and usually those drop-in hours aren't early in the morning, but just think about creating a lower barrier environment. So other things are safe injection sites are absolutely part of harm reduction, and as I mentioned about lowering barriers, just generally lowering barriers to care in every capacity that you can think of. Where it's not a punitive system for people not to show up. I understand that's very difficult to schedule, and there's consequences for that and people's practices and trying to keep things organized and trying to keep things efficient, especially as healthcare is strained so much at this point. Other things are things like drug checking services, safer inhalation kits, getting someone to go to a family doctor once a year. I mean, that's harm reduction. I could go on all day with what harm reduction is, and I'm sure you can think of many of your own examples of that. So there's sometimes you get a lot of pushback about some of these ideas. When it's they say, well, these are new and they're novel approaches, and they're not necessarily evidence based. And you know what? That's absolutely true. There isn't evidence for all harm reduction initiatives. In fact, many of them are so new that there's no ability to get evidence for them. But the concept of harm reduction is not new. It's not novel, and you only need to think to. It's in every one of your neighborhoods that you're seeing me from right now. It's just look to your corner pub or tavern or bar, whatever you want to call it. And think about at the end of the night or at any point in the day, for every cup of coffee that your bartender will serve to a patron that has had too much to drink. Well, every one of those cups of coffee is harm reduction, right? They don't want that individual to go home and get in an accident. They want to keep their customers alive. And every time that bartender says, okay, you know what, you've had a little bit too much to drink, so let me give you this coffee and see how it goes. Let's take a break and let's chat. And they come back in 10 minutes and check, and maybe they take the keys from that individual as well. And well, that's harm reduction as well, right? So just thinking about those things, I mean, those have been around forever, right? They've been doing that for 70 years, I imagine. And so harm reduction isn't a new concept, but yes, some of the ideas are new, and we're trying different things to keep people alive. So anyway, thank you for listening to me, and bye now.